Happy New Year, everybody. Chris Good from VSI, just sharing with everybody a little bit about our New Year's resolutions for this year, hoping to hear back from y'all about some of yours and really try and inspire people. So, all of our doctors are coming together this year, and we all know that if we set goals, and especially if we talk about them and share them with others, we're more likely to achieve great things. And so, we're all sharing our resolutions. We're going to see how well we all do holding ourselves to these as the years go on. And so that's a challenge amongst all of us. Invite you to think about something like this with your family or your team, because we definitely know for sure people who set goals, write them down, share them with others publicly are much likely to achieve whatever their goal or their dream is. So for me, this is something I've been really working on actively for the last couple of years, and I actually feel like I've made a lot of progress. I've set weight challenge and lost a lot of weight and fitness goals. And many of y'all know about my family and G5, which is our family initiative to try and work on our bettering ourselves both academically, at school, in sports, etc. And so as I'm looking at this year and saying, gosh, I've already tried to do meditation, I've tried to work on mindfulness, what is it? And so as I look at seeing patients and my day, which I do find pretty busy, I think many of us do, I think one of my real gifts or one of my strengths is I do think I'm very good at being present when I'm in an exam room talking to a patient, counseling someone, and even perhaps more so when I'm in the OR. I feel like I'm dialed in, right? I'm present, not much distracts me, I'm not rushed, and that's an awesome feeling. Now, the downside of that is I'm pretty much always behind schedule when I'm seeing patients because I don't rush, but I hope that it's worth it for people. But as I'm looking toward this next year, I'm looking at how busy the schedule goes and things just keep getting putting on. And I really want to protect that ability to try and be present especially with my family, and especially with my kids as they're getting a little bit older. And so, um, our my personal goal this year, or my resolution, is to purposefully set aside time for my family to spend time, but also specifically when we're going to eliminate distractions and things that can really put you out of the situation. The cell phone going off, checking on a patient, getting a text, those kind of things that you're kind of always multitasking as a parent, and your kid's like, but dad, trying to set around some time to make sure that we're mindful and present when it comes with the family. And I've shared stories before about with our initiative about how that has opened up discussions with our kids about their academics or avoiding drugs or all these kind of things that come, and especially dealing with teenagers that are getting older and they talk less, making sure you capture those critical moments when they do want to talk, and there's no better time. And so that's my resolution, is to actually put that on the schedule purposefully ahead of time so other things can't encroach on it, and make sure that we know that's a special time for us so that we get to really focus on having those moments together. So we'll see how it goes. Obviously, my resolution does depend on some other people playing along, and they have their own ideas. But I hope that inspires you to make some kind of really meaningful resolution. And I will say, it's hard to get started, but 2.5 years ago, I really started this process. There've been ups and downs, but I've really been able to do a lot and really check off a lot of those goals that I had a couple of years ago, and it really feels great looking back. So it's never too late to start setting small goals to achieve big things in the future.
Happy New Year. I'm Dr. Jazini. Some of my patients call me Dr. Jazz, Jazzy, whatever you're comfortable. What I want to talk about is what sort of is my sort of challenge for the coming year. And in order for me to explain that, I want to kind of go back 5 years and kind of talk about what's inspired me to make some changes and sort of where I've come and where I'm going in terms of sort of the challenge, my personal goals, and what I also preach to my patients. So about 5 years ago, I actually had to get life insurance, and so I was doing some testing, and what I noticed on those my lab results is that although my cholesterol was well controlled, my liver enzymes were not perfect, and heart disease runs in my family. My dad, my grandpa on my dad's side passed away in his 50s from a heart attack. So I take that very seriously. So for about a decade, I was already on statins, medication to help reduce your cholesterol levels. And so what I had my primary care doctor do is, he recommended getting inflammatory markers for your heart. And to my surprise, those were not okay at all. They were actually pretty abnormal. So what that really drove the point to me is you cannot medicate yourself out of an issue, right? So you really need to reduce your inflammation levels. And in order to do that, the only way to do that is you got to make some lifestyle changes, whether that's eating better, sleeping better, and exercising in a much more habitual way, right? It can't be, okay, I'm going to work out 2, 3 days a week. It needs to just be a very intentional, regimented pathway. And so over the past 5 years, I did a lot of work on losing weight, sleeping better, and exercising more regularly. I started with what I preach to my patients, which is you got to focus on your core. So I did a lot of calisthenics, yoga, really focusing on the core before I go back to weightlifting. And I made a lot of progress. My inflammatory markers, the cardiac inflammatory markers, have come back to a normal level. My liver enzymes have normalized. I went from having a fatty liver to not having a fatty liver. So I've already seen the results. I feel better. And so I'm continuing to push myself to that next level. I'm going to turn 40 in 6 months. And so the commitment I'm trying to make and the challenge is, how do you take it to that next level? And so for guys especially, visceral fat is a big problem. It's incredibly inflammatory. And so I'm going to, again, get data. At the end of the day, the number one thing is you got to know what the problem is before you can find or seek the solutions for that problem. And so I'm going to get something called a body DEXA scan to measure my body fat index, but really specifically looking at visceral fat and working on, for the next steps is really, I've been trying to add more weightlifting in a very safe way, looking at flexibility, really modulating the amount of weights I'm doing to help with that, and also to sleep better. So that means cutting down on the coffee after a certain amount of time, eliminating any kind of drinking, especially during the week, working on some of the things you eat, especially if you eat past 7 p.m., it can really affect your sleeping. And so sleep, diet, obviously exercise, the things that we all know. How do you do it, right? So then my message is, first of all, get data, take baby steps, but baby steps in an intentional way so that it becomes a habit. If you just have a resolution or you just get on this most recent fad diet, you're just gonna yo-yo, right? I've been there myself, and I've done that. But you have to have a commitment, and you have to just start from somewhere. And it's not easy. I get it. But if you have the data and you have something to then compare it to, it can be incredibly self-motivating, right? Ultimately, none of us make changes in life unless we desire it and it comes from within. If it's someone else telling you what to do, a doctor, a friend, a parent, or a spouse, it's ultimately not going to have as much of an effect unless that motivation comes from within. So first of all, have some introspection, make baby goals, get the data, and then come up with some concrete steps. Okay, over the next 6 months, I'm going to do A, B, and C. Over the next year, 2 years, 5 years, anything in life you want to do, obviously, if there's no planning, there's not going to be as much success. So this is my journey. I wish everyone luck on their journey, and sort of relating this back to what I do as a spine surgeon and what I tell my patients is, whether you have a nerve problem, you have a back pain, the key is, let's first just understand what the problem is. Let's sometimes look at your alignment, look at how you're moving, your flexibility, whether that's getting x-rays, working on mobility. Sometimes you have to get more advanced imaging like an MRI or a nerve study. Understanding where the problem is can prevent so many other things, and oftentimes we can fix these issues using non-operative means, physical therapy, regenerative treatments, and surgery really being the last resort. So please seek help. Try to understand what it is that you want to accomplish, because there's definitely a very, very high chance of success if you follow those rules.
Happy New Year, everybody. I hope you guys had a wonderful 2024 and you guys are going to looking forward to a wonderful 2025. I'm Niteesh Bharara. I'm also known as Dr. B to many of my patients. And so today I want to talk to you about my New Year's resolution. New Year's resolutions are it's an opportunity for us to kind of reflect on 2024, to reflect on our lives and try to figure out what we can do to make our lives better and improve ourselves. And so, this takes us back to what I did in 2024. In 2024, I really wanted to come up with a New Year's resolution where I can improve my life, improve my sleep, improve my mental health. And so I came up with this idea that I am going to read before bed 5 out of the 7 days per week. And this would allow me to disconnect from my normal life, kind of get away from the screens and Netflix and the TV and allow me just to concentrate on something different. And so on paper, this sounds really easy. In reality, it was an absolute disaster. It was a challenge. And so I made it through about a month. But after about a month, I failed. And I failed because of lots of different reasons. And so in life, what I realized is that there's a lot of responsibility. You have your responsibilities of your family. I have 3 kids. They're young. They have events going on. As soon as they get home, they jump all over you and they want your time. They want to tell you what their day is like. They want you to play with them, and so you are exhausted by playing with them. You're hearing everything about what they did that day, and then you're trying to put them to bed. And sometimes this all takes 1 hour, 2 hours, but sometimes it can take 3 or 4 hours depending on the night. And so by the end of taking care of patients all day and spending time with the family, especially my kids, it leads to just sheer exhaustion. You're just exhausted. You just want to get away from everybody and everything. And then what I realize is when I'm done with all that, now I have the responsibility of my New Year's resolution, the resolution to read before bed. And so I started failing one day and then 2 days, and then you start dreading the idea of your New Year's resolution, and then you failed a week. And so it lasted about a month, and then a month went in, and I realized that this is just not going to happen. And so in 2025, I want to come up with something different. Right? It's not going to be a big change from last year, but maybe a small change, something that I can do to something I can change to actually succeed. So this year I'm changing from 5 days a week of reading before bed to 3 days a week. And so you'll probably ask, well, why 3 days a week? Well, 3 days a week gives me enough flexibility to fail. Right? I can fail one day. I can watch Netflix if it's really calling, or my wife wants to go to an event, or my kids are busy and want to go do something. I can fail that day and not read. But what I need to do is I only need to do 3 out of the 7 days. So 3 out of the 7 days, I can succeed. I can change my mental health. I can improve my life, and allows me to disconnect from my normal reality. And so this is an opportunity for me to actually make a positive impact on my life. And so, one of the things I was trying to think about is, well, what was the first book that I was going to read? Well, I think the first book, ironically, is a book that one of my patients told me about, which is called Atomic Habits. I think it's by James Cleary. And so this is a book that really discusses how you can create long-lasting habits. And so this is the first book that I'm going to read. But if you guys have any recommendations, I'm always open to recommendations. I'm looking forward to something. So send me a DM on Instagram or send me an email. Just get in touch with me. I'll be happy to take your suggestions. So I'll kind of leave it with my advice. My advice is that we don't need to make large, drastic New Year's resolutions. I tried to make one, it didn't work. I think what you really need to make is small resolutions that you can actually succeed with. Once you succeed, you can build on that year after year, more long lasting improvement in your lives. But if you make these drastic ones, you're likely going to fail. And that's just going to discourage you, depress you, and make you not want to do another New Year's resolution the following year.
Happy 2025. I'm Dr. William Kemp. I'm a neurosurgeon at VSI. Today, we're going to be talking about New Year's resolutions. As I think back on 2024, I'm absolutely proud of all the work and progress and victories we've had taking care of the greatest patients in the world. As I look forward to 2025, I expect even better things for all of our patients. One thing that I'm always thinking about in terms of New Year's resolutions is how can I improve? One thing that I love doing is traveling. And we talk about work-life balance. I think it's really important to know that before we can take care of other people, we have to take care of ourselves. I get my release, my ability to passionately take care of people by traveling. When I travel, I never take the guided tour. I use the same philosophies of just like we take care of patients in the clinic and in the operating room, of knowing the nuances of their clinical examination, their symptoms, and also the surgeries. I do the same thing with traveling. I'm researching, talking to my family and friends about where do I go visit? How do we do it? How do we get there? What do people eat there? What do they do in their free time? My goal when I go on a big travel expedition, if you will, is that I want to become embedded in the culture so that I can learn as much as I possibly can and take away the most I can from a trip, so to speak. Some places that we're planning on going in the next year is Gettysburg, Pennsylvania. It's important for you to know that I'm a huge history buff. For those of you that don't know, those that don't know their history are doomed to repeat it. We're planning on going to Gettysburg, where we're not taking the guided tour. We're learning as much as we can about the battle that took place, all of the lives that were lost, and what it did for our country in the 1860s. Additionally, in the fall, I'm hoping to take a trip to Japan with one of my good friends, where we hope to actually hike Mount Fuji. This is a huge trip. I'm absolutely ecstatic about the opportunity to become quote unquote embedded in the Japanese culture and have the trip of a lifetime. I do think that from these trips, this will allow me to really take care of people passionately and effectively in 2025. We did such a great job in 2024. 2025 is going to be even better. I think that for all of you watching at home, how can you take care of yourselves? Well, find your passion, take care of yourself, and then turn around and do it for somebody else. I will say in 2025, I wish you the very best. Happy New Year. And as always, go Irish.
Hi, guys. My name is Dr. Mehta, and I'm an interventional pain and sports medicine doctor at VSI. So the question is, what is a small change that I'd like to make for the next year to try to maybe have a big impact on my health? And I wanted to take a step back. And the problem I usually face is I have a very big sweet tooth. Anybody that knows me knows that I'm often willing to skip the meal for the and go straight to the dessert. But I do have a family history of diabetes. My grandfather had diabetes. My mother has diabetes. I unfortunately am on the pre-diabetic spectrum. I'm not pre-diabetic yet. But I know that's in my future if I'm not careful about my health. And so then the question becomes, okay, it's hard to necessarily find time to work out every morning, right? Having two kids and work and all these other things. Time is sometimes an issue. Laziness is definitely an issue. And so what is something small I could do? Try to work harder, not harder, work smarter, but not harder, and have some small change that I can make that, in a world of resolutions and things that we have to do every day and it seems kind of daunting. What is something small I could do? Hopefully try to do it every day that can hopefully really have a long-term impact on my health. And so there's someone that I follow on Instagram. Her name's the Glucose Goddess, but she's a doctor who talks about sugar and how our sugars and what we eat affects our glycemic index and affects diabetes. And one of the takeaways and studies have shown is a good 15 to 20-minute walk after meals, within 15 to 20 minutes after meals, can significantly decrease the glucose load on your body. by as much as 30%. And so that's a huge deal, right? Someone that, in terms of diabetes, what is the definition of diabetes? Is glucose places a load on your body. Your body is not able to compensate for that. And so then you have all these other health issues that we have heard about. And so, how can we combat that? And so, it's very quick. And so, my resolution or my goal is to take a 15 to 20-minute walk between 15 and 20 minutes after lunch every day, and hopefully decrease that glucose load on my body, which allows me to combat my the status of my health, but hopefully also allows me to sneak in a little bit of sweet food after lunch because I know I'm going to work it off quickly anyways. Now, obviously, one of the challenges with this goal is still time, right? Sometimes I run over on my lunch patients, or I have a meeting, or I have to record a podcast. When do I get the steps in? And so the goal is activity, right? And so even patients that, or people that don't have maybe a good lunch break, right? You're on the go, or you only get 20 minutes to scarf down your food. The goal is any activity, right? So I would keep in mind more about the 15 to 20 minutes of activity, not necessarily feeling like you're obligated to do it right away. Anybody that walks 15 minutes in a day is doing more than not walking at all. But if you are trying to walk and decrease your glycemic index, then the goal is, well, how do I optimize that? So then if you can do it after lunch, or tack it on after breakfast, or even dinner if you have the most free time in the evenings, that's the way to optimize the workout that you're doing to have the most significant health impact. So again, the goal is movement. The ideal goal is 15 to 20 minutes a day, 15 to 20 minutes after food or eating food. But if you can't do that, the goal that I would push you to have for yourself is 1 or 2 more days than what you're currently doing. So if right now you don't get any activity in, then at least once or twice a week. If you're someone that tries to go on a walk once a week, then maybe go 3 or 4 times a week for 15 to 20 minutes, and just push ourselves to be a little bit better every single day. And hopefully we can all be healthier in 2025.
Happy New Year. Happy 2025. Hope everyone had a nice Merry Christmas. My name is Dr. Nguyen, also known as the Golf Doctor on my Instagram. I'm here to share my 2025 New Year's resolution with you. And when most people are looking to find a New Year's resolution, they look at the year before and they're seeing, what they can improve upon, what they did in the past year that worked, that didn't work. So when I look back, I wanted to find something that is going to help with my new focus of, longevity and vitality. And I'll go through the story where how I got to this stage. But ultimately, my goal for 2025 is to get more sleep and better sleep. So most people underestimate the power of sleep. When I was in college and med school and residency, sleep wasn't a big deal. And I always overlooked sleep. 2, 3 hours of sleep, that's good enough for me. I would get up, I'd study late, I'd sleep for a couple hours and get up, have my coffee and go to class or go, round on patients in residency. It wasn't a big deal, but you were young and healthy then, so your body recovers a little bit better. By the time I got to my 40s, then I felt it a little bit more, and I tried to get a little bit more sleep, and I focused more on, physical health. So I started getting up early, around 4:30, 5 o'clock, to get to the gym before work out about 2 hours, and then get to work. So I still try to get sleep, but usually with, being kind of distracted with my phone or email or work. I usually didn't get to sleep till 11, and then I'd get back up at 3:30 to get ready to get to the gym at 4. So again, not much sleep, but I got by, and I was focusing on my health and getting physically stronger. But as I got into the 50s, I started losing a little bit of gain. I didn't feel the energy that I had when I was younger. Getting to the gym, I was still getting a little bit more sleepy during the day and maybe not as focused. So I started looking into what was going on, and I finally found that sleep is an important function that you should never overlook. It's the one thing that can improve your, your physical appearance. It can improve your psychological and medical health as well. The benefits of a good night's sleep are, improves your mood. It helps you focus better during the day. It is an anti-aging component to it. Um, it helps with weight control, believe it or not. So the more you sleep, it actually works on weight loss. And so that is also important. And for my chronic pain patients, they benefit because you have less pain the better you sleep. Your body and your muscles are able to recover if you're an athlete, and improves your performance the next day. So that's what I'm working on for 2025. You know, I've already started, but don't be discouraged. A few tips is that sometimes I can't sleep because you're just trying to get this new regimen and get your body used to it. So, sometimes I'm sitting there staring at the ceiling at 2 o'clock, and I'm really getting frustrated and mad at myself because you know, I know I have to get this much sleep to feel better the next day, and I'm not getting it. So it's kind of like a vicious cycle. But give yourself, some leeway, because this will take time to improve. And if you follow me, I'll go into how you can improve your sleep architecture and tips on how to get to sleep and stay asleep. Happy New Year.
In 2025, my goal is going to be to try to reduce screen time, not just for myself, but for my wife and kids as well. It allows us to really connect much more as a family, and also the less we hunch forward, the safer it is for our necks.